Good morning. We want to look at some of the specializations in social work. I think it's a concern of every professional in any field as to how to build their career and which areas they can work or advance their career. Social work, as we know, is a professional field, but within it, individuals can still specialize to tackle certain issues. So our discussion wants to center on some of the areas that products of social work can engage in, whether at diploma, degree, or advanced level. So I want to welcome you all to our discussion on the specializations in social work. Perhaps we need to make certain observations. One, that social work is a profession in which trained individuals are devoted to helping vulnerable people and communities work through challenges they face in their everyday life. It's also important to note that social workers are found in every aspect of community life, including schools, hospitals, mental health clinics, senior centers, or what we call homes for the aged, elected offices, private practices, prisons, military, corporate organizations, and also other many public and private agencies. Some social workers help clients who face a disability or a life-threatening disease or a social problem. For example, those faced with inadequate housing, those suffering from unemployment, those engaged and suffering from substance abuse. They also engage in assisting families that are experiencing various forms of domestic violence or domestic conflicts. Some social workers too engage in empirical research where they formulate studies with a bid to understand empirical issues affecting common or affecting modern societies. They also advocate for improved services where they feel that certain vulnerable groups are not adequately serviced. Some engage in system design or policy design and also involved in planning as well as policy development. So these are various domains that social workers work. We now want to pay our attentions to each of them and look at them in details. One of the areas of specialization that social workers may engage in is what they call social advocates. Social advocates. In other words, products of social workers can become social advocates. Now, this area of social work focuses on advancing campaigns which are aimed at enacting or reforming policies and systems that promote social justice as well as equity. It also focuses on the development, promotion, implementation, as well as evaluation of policies aimed at improving social conditions and equality for individuals, families, groups, and communities, and also social policies that promote social justice. Social work advocates also provide administrative support to various organizations that are engaged with advocacy and social services. For example, they may work for a nonprofit organization, a government agency, or a private for-profit organization to enable them or to assist them in undertaking activities, for instance, planning public outreach events and managing media campaigns to spread information about their advocacy work. So when you talk of a social advocate, is simply a social worker that is interested in advancing issues that affect society in terms of amplifying them and in bringing them to light so that authorities and other players might know. But not just bring them to light, but also campaigning towards addressing them. Where policies are lacking, a social worker might insist for the development of policies to address issues affecting vulnerable population. Sometimes there are policies that are existing, but new issues that have emerged within a particular field have rendered existing policies inadequate. And therefore, it is still the work of social advocates to campaign for reforming existing policies to make them more responsive and effective in addressing emerging issues. So a social advocate is somebody who works with agencies, government, public, private, and even corporate entities to ensure that the plight of vulnerable people are addressed through policy development, policy reforms, as well as their implementation. So this is one area that social workers can engage in. The other area that social workers can engage in, or the other specialization of social work, is what we call humanitarian social workers. And this area of social work focuses on training personnel and preparing them to address the plight of people displaced by disasters such as earthquakes, fire, floods, accidents, armed conflict, and droughts, among others. Humanitarian social workers are trained on how to direct services in emergency situations such as internally displaced persons camps and also in refugee camps. They are also trained on how to support the efforts of national governments, international organizations, and non-governmental organizations to enhance the social well-being of people in displaced camps or people in humanitarian situations. Humanitarian social workers also help in the provision of mental as well as behavioral health therapy and restore the social functioning of individuals that have been uprooted by disasters from their habitual places. Lastly, they also help in soliciting support for displaced people as well as amplifying their plight for national, international response as well as support. So basically, when we talk of humanitarian social workers, we're basically talking of a class of social workers that specializes in handling vulnerable people within the context of humanitarian work. These people are largely individuals that have been displaced by disasters. These disasters could be earthquakes, could be fire, could be floods, could be accidents, could be armed conflicts, could be epidemics, among others. So people that need humanitarian services, their needs are special, and therefore a specially designed form of training in social work is normally done to prepare individuals that seek to work with them. This area is what we call the humanitarian social work, and products of such training, we call them the humanitarian social workers. Another important sub-area or specialization of social work is what we call behavioral social workers. Now, this area of social work is concerned with the training of social workers who provide counseling and psychotherapy services to address mental health and emotional issues. They include clinical social workers, substance abuse counselors, hospice social workers, and child social workers. Let us take some time to understand what each of them is and what they do. We begin by clinical social workers. And we want to mention that clinical social workers provide mental health services to patients from diverse backgrounds and settings, with most of them being licensed providers in mental health services. Then we have child social workers. Their main responsibility or their main training is aimed at helping parents of children with developmental disabilities to understand their legal rights and also advocate for special services for children with developmental disabilities. The other one is a substance abuse counselor, and this is an area in social work where individuals are trained to support the recovery of those with substance use disorders. For example, they are trained on how to counsel or how to take through individuals that are addicted to drugs so that they can come out of such addiction and then regain their normal social functioning. Then we have what we call the medical hospice social workers. Now, these are social workers who work in hospice or institutions or centers that we normally call end-of-life care facilities, and they have special training for working with patients, receiving hospice care, and their family members. So these are the various areas of behavioral social workers. Basically, when you talk of a behavioral social worker, we are referring to an individual that has received sufficient training that enables them to provide counseling and psychotherapy services to individuals with mental health and emotional problems. We have enumerated the various types that come on board, including clinical social workers, substance abuse counselors, hospice social workers, as well as child social workers. Another very important area of specialization within the context of social work is what we call community organizers. Community organizers, and this is an area of social work in which training is provided to social workers on how to organize communities in a way that enable them identify their needs, mobilize resources, establish collaborations for assistance, and also then take appropriate actions to improve their condition. Community organization is also used in response, rather in resource mobilization and equitable distribution of services at the community level, improving linkages and coordination between the social policy agency and the community. The focus of attention in community organization is on how communities can utilize their strengths to identify and solve problems afflicting its members. The aim of community organizing as a specialization in social work is to train social workers on how to work with communities to identify needs, mobilize resources, and promote positive social change. Social workers in this area of social work are therefore meant to work with the communities to address their social problems, promote social justice, and advocate for change. In other words, community organizers is a branch of social work or a specialization within social work in which individuals are trained on how to bring members of the community together, to rally them together, to help in addressing their needs. First, in terms of identifying what their problems are. Secondly, in terms of mobilizing resources within themselves. And third, in terms of establishing collaborations and assistance between the community and other entities. This branch of social work is recognizing the fact that unless communities are mobilized and unless communities are engaged, are involved in terms of identifying their problems, in terms of mobilizing resources, and in terms of establishing linkages, then it can be difficult for such members of the community to come together and work out issues. This approach or this branch of social work is also encouraging or recognizing the fact that the input of members of the community in addressing the issues that face them is important in several ways. One, in terms of understanding what their problems are. Secondly, in terms of accepting that they indeed have a problem and expressing a willingness to work with social change agents, and also in terms of sustainability of the programs that may be brought about by the external players. So this is also an important area of social work. The other important area of social work is that deals with monitoring and evaluation. So we call them monitoring and evaluation specialists. Now, by monitoring, we mean a continuous process of collecting and analyzing information about a program and comparing actual against planned results in order to judge how well the intervention is being implemented. Monitoring uses the data generated by the program itself to make comparisons across individuals, types of programs, as well as geographical locations. Evaluation, on the other hand, is a process that systematically and objectively assesses all the elements of program to determine its overall worth or significance. Social workers in this area of social work are trained on how to analyze policies, programs, and regulations in order to establish their efficiency and effectiveness. They also conduct research, propose legislations, and suggest alternative approaches or new programs based on the results of monitoring and evaluation work. In other words, every policy, every program, every project that seeks to address the plight of vulnerable people must be assessed at some point just to try to understand whether it is achieving the intended results. And one way of doing this is through monitoring and evaluation, so that at the end of the day, policymakers would wish to know whether the program is achieving its intended purpose. But not just that, they're also interested in understanding what are some of the challenges that the implementation of program is facing, and what is it that can be done. The other thing might be, what are some of the things that are emerging that can be a hindrance to the implementation of the project, or that can be a resource, or that can enhance the implementation of the project. So that at the end of the day, they're interested in understanding, are we achieving our objectives? If yes, at what cost? Is it reasonable? If it is reasonable, within the reasonable cost, then there's efficiency. If we're achieving the intended objectives, but at exorbitant cost, again, it offers us the opportunity to review and see what can be done so that the cost can come down, while at the same time achieving the intended objectives and goals of the project. This is the work of social workers that are trained in a specially designed area called monitoring and evaluation. And broadly, They are called monitoring and evaluation specialists. Another important area of social work is what we call forensic social workers. This is a specialization which involves training social workers who will work within justice and correctional institutions, gender-based violence crisis centers, police departments, and even correctional facilities. Forensic social workers offer counseling. They undertake referrals of patients or clients from one center to the other, and they also offer other helpful resources to juvenile as well as gender-based violence victims within the justice system. Forensic social workers, they also work with a variety of populations, such as children or families that are involved in custody disputes, defendants in criminal trials with a mental health defense, newly released inmates striving towards rehabilitation, as well as survivors of domestic abuse or other crimes. Forensic social workers are also called on to present expert testimony in court during legal proceedings. For example, they may speak to an individual's mental state or family dynamics as it pertains to the case at hand. They also represent minors and advocates for the outcome they believe is in the minor's best interest. Basically, when you talk about forensic social workers, these are workers that work with law enforcement agencies. They work with the justice systems. They work with correctional institutions just to help them understand aspects of the accused or victims in terms of what predisposes them to criminal conduct or to delinquent behaviors. And in that case, therefore, they become extremely important. Their inputs are important. For example, if there's dispute over custody of the child between the father and the mother, then the opinion, the expert opinion of forensic social workers become quite important. This is based on the understanding of whether a child would be safer to live with the father or with the mother based on the kind of responsibilities and behaviors that the two parents have exhibited in the life of that child. So courts can be persuaded by their decisions, by their opinions, to make rulings that fall within what they have recommended or the kind of advice they have given. So they are quite important. Again, another very important area of specialization of social work. The other important area of social work is administration and management. Administration and management. And this area of social work deals with training of social workers who will be charged with the transformation of policies into social services through the implementation of activities. It is concerned with the identification of social objectives, formulation and implementation of proposed programs to achieve the objectives laid down in any given social policy. Administrators are also trained on how to develop and implement regulations and rules to aid in the implementation of social policies, as well as government personnel in the implementing agencies. They are also trained with the documentation and keeping of accurate and verifiable records of activities, expenditure, beneficiaries, stakeholders, engagement, and financials, among others, for the implementing agencies. Social workers in this area, therefore, lead and manage social service agencies by ensuring that ensuring the effective delivery of services as well as advocating for resources. So any person that manages or in charge of a social policy or a social service agency, we call them administrators or managers. They are social welfare administrators or managers. Now, they are other than the general social work skills that they are given. They are also given special training on how to manage institutions, how to manage resources, how to mobilize resources, how to manage people, and how to collaborate, bring collaboration between one agency and another agency. They're also trained on how to implement programs that go towards addressing the plights and the needs of vulnerable populations. So any agency at any level that offers social welfare services, the person that leads it, we call them social welfare administrator or social welfare manager. Now, for them to excel in that responsibility, they are normally offered special training in that area. The last area of specialization that is also important is what we call the school counselors. Now, this area of social work specializes in training social workers who will work with the students to support them in achieving their academic and career goals. School social workers act as the connection for school, home, and community services to help children with emotional, developmental, and educational needs. Most school social workers practice in public and private schools, while others work in social services agencies. School counselors, who may meet with the students individually or in groups, provide career coaching, develop programs to improve student wellness, as well as academic achievement in students. Many school counselors have the credentials, provide therapeutic care for students, and also collaborate with families, educators, government, and public in service delivery. Ideally, all schools have children that may face one challenge that is behavioral in nature. The individuals that are most suited to address such challenges are the ones that we call school counselors. Their area of training places them in a unique position to address the challenges that are faced by learners. They are trained on areas that gives them the opportunity to advise students in terms of their career goals, time management, choice of careers, among others. So it's also an important area. In the developed world, most schools at all levels, from primary, have school counselors. In Kenya, though we have them, but they are largely drawn from the pool of teachers that are available within our schools. And some of the teachers may not have undergone specialized training in counseling. So they double both as teacher as well as counselor. And this already we know has certain shortcomings, because combining the work of teaching as well as counseling can be quite a difficult task and might lead to a divided attention in the focus of the teacher, to the detriment of children that they may need their services. I want to thank you so much for your time, and I want you to note down anything that you want more clarification on so that we can address it at appropriate time. Thank you.